If you think about all the health threats that governments are trying to respond to, bird flu and Tamiflu in particular is probably really the one medicine that most people will have heard of. When I started studying international relations, traditionally we wouldn't talk about health issues at all. It wasn't seen as a very important topic. But looking back over the past decade, we've seen so many different health issues really kind of get the highest levels of international attention. Tamiflu for us is a really great case study for looking at all the complicated challenges and tensions that emerge when you try to secure people and populations with the use of pharmaceuticals. The Center for Global Health Policy remit revolves, I think, around three key things. The first is that we really want to understand the international diplomatic environment. We need to understand who are the key diplomatic players who can influence policy on health, what are the agendas, how can these agendas be aligned. We also want to understand, secondly, the entire policymaking process around global health. Policymaking is a really complex process. You have to set agendas, you have to find solutions, you have to implement them. We want to understand the entire policymaking cycle. And we also finally want to understand who has power when it comes to really improving global health. There are millions of people around the world whose life expectancy is much shorter than it would be for people in high-income countries. So we have to work harder to make health more equal around the world. But of course, there are also entrenched power relations that prevent often good ideas from being implemented. And so we want to expose and understand some of those power relations as well. To me, what's personally really interesting about doing the research on Tamiflu is unexpected discoveries. So one of the things, for example, we found out was that when Tamiflu went through the initial process of regulatory approval, together with a sister drug called Relenza, there were actually huge fights that were taking place inside the regulatory authorities, especially the FDA. And so we kind of uncovered a whole interesting story. People left. There were huge internal divisions, which are fascinating. We unearthed quite interesting political connections. So if you look at the small biotech company that developed the drug, we began to research who was sitting on the board, and we found that one of the people on the board was Donald Rumsfeld, who of course would later go on to be Secretary of Defense in the Bush administration. So kind of whole connections between economics and politics. To me, it was also actually really fascinating to learn more about what constitutes evidence when it comes to a drug in terms of their safety and effectiveness. I discovered there's so many different ways of deciding what counts as evidence. So there's a whole, it's a fascinating question. It gives me huge, deeper appreciation for the kind of subtleties and complexities of taking and designing drugs.